I'm Dr. Julia Carroll from Toronto, Ontario, and I'm a board-certified dermatologist. Rosacea is a chronic inflammatory condition. There are 4 different types of rosacea. So the first one is erythematotelangiectatic, and this is the type of rosacea that's mostly redness and flushing of the face or broken blood vessels on the face. The second type is papulopustular rosacea, and in that type of rosacea we tend to see bumps and whiteheads on the face, so known as papules and pustules. The third type of rosacea is phimosis, and that's the thickening of the skin that you can see on the forehead, the nose, and the chin, most commonly on the nose. And the fourth type is ocular rosacea, so that's rosacea of the eye, where you may see some redness of the skin around the eyes. The eyes may feel a little bit gritty, sensitive to light, and sore. Even though there are 4 types of rosacea, one person may have 1, 2, 3, or even all 4 types of rosacea at the same time. And you may have one type at one time and then another type at another, but that doesn't mean if you have the redness and the flushing that you will necessarily progress through all the types of rosacea. People suffer from different combinations of the subtypes of rosacea. Over 3 million people in Canada have rosacea. So we usually see rosacea appearing between the ages of 30 and 50. You see it in both men and women, but for some reason we do tend to see it more in women. Rosacea tends to affect people who are fair and often people who have a Celtic background, but it can affect people from any skin type. In terms of what causes rosacea, the short answer is we don't know. However, as dermatologists, we do know that environmental factors, as well as genetics, who your family is, do play into the presence of rosacea. Some of the things that trigger rosacea would include sun exposure. We also see when people go from extremes of hot or cold that their rosacea can become worse. Exercise can also worsen rosacea. We also know that eating spicy foods or even eating or drinking products that are hot can flare rosacea. And for some patients, they find that mental stress can really be a big trigger for their rosacea. For people who suffer with rosacea, one of the problems is that it often feels worse than it actually looks. So their skin may be sensitive and sore, and that may be difficult with them day to day. Also, they're very sensitive to different products, so they find it hard to purchase things, to use products on their skin, and they just generally feel embarrassed because their skin is red and they have what appear to be breakouts on their skin, even though they're adults aged between 30 and 50 years old. So some of the patients find that they'll actually forgo social activities or withdraw at work when they're having flares of their rosacea, so that can be very stressful for people. There are a number of ways that we treat rosacea. One of the most important things is to remember that daily sunscreen use can be very protective for rosacea-prone skin. The second thing is that as dermatologists, we prescribe topical creams for rosacea. So these might be antibiotic creams or they could be anti-inflammatory creams. And we also have topical products that we put on that will temporarily reduce redness. If your rosacea is more severe, then as a dermatologist, we may opt for oral or pills. So that may be antibiotics, or it could be a product known as isotretinoin. And then in terms of the cosmetic or the very visible aspects of rosacea, people often are concerned about broken blood vessels on the face. So for that, we have various lasers that we can use that will reduce the blood vessels and the background redness in the face. And then finally, I think it's always important to discuss the use of camouflaging cosmetics, because sometimes we haven't got the rosacea fully under control or somebody's having a flare, so it's nice for them to have options to be able to temporarily cover up a flare so that they feel more confident going about their day. You may find that the sensation of your skin, the tenderness or the dryness, may improve quite quickly within 1 or 2 weeks, but it sometimes takes a longer time, 4, even 6 weeks, to see improvement in the breakouts or the bumps on the skin. So it is important when you start an initial course of treatment that you really give it 6 weeks or more to see the full benefits of that treatment.